Todd Groden here with Life West College of Chiropractic Communication Club, and I happen to be future DC, but it is DC right now, which is driving chiropractor. In the truck is Dr. Scott Rosa, who is an Atlas orthogonal chiropractor, and he's an upper cervical specialist. He also teaches a diplomate program, which is 3 years and 300 hours beyond a regular doctorate. Dr. Rosa, when you started 38 years ago, how has your philosophy changed and grown as you have now been adjusting over 38 years?
Well, my philosophy hasn't really changed. The philosophy is what's grounding me for 38 years, to know that our journey and goal as chiropractors are to go ahead and, when patients come in for assessment, when they're suffering or sick and are having issues that are related to something we believe can be helped through chiropractic care, my philosophy is that the subluxation/misalignment is usually going to be at the root of their pain and suffering or the dysfunction. And my philosophy has always been grounded to the extent that I love being a chiropractor. Chiropractic has brought great health and vitality to myself and my patients. And subsequently, I just enjoy every day going to work with the knowledge that the body that has, the power that created us is what can heal us, as we all know philosophically. Philosophically, the premise is that when patients are in adjustment, that we get the full expression of life, the body's capability of healing. They go hand in hand. So my philosophy hasn't really changed. It just grows more stronger by the year because of the amazing outcomes that we see when I render chiropractic care to my patients that come and seek that care. Pretty much.
Dr. Rosa, you studied under Dr. Crowder. Dr. Crowder was taught by B.J. Palmer, and you first started out as toggling, and then what created the change for you to go into using instrument?
When I went to chiropractic college, I went through clinic as a strictly upper cervical clinician, and I was very pleased, very successful at doing HIO, or side posture toggle recoil. I was very, very good at it. I was very masterful at doing a toggle recoil adjustment. And then when I got into practice, as my practice started to build, when my first mentor, Dr. Crowder, when I interned with him, Crowder did both hand adjusting, toggle recoil, side posture, but he also had an instrument. It was actually a Pedibond instrument. And I asked him one day, why do you use a Pedibond instrument? And his answer to me was, anything he can do with the instrument, he could do by hand. But he said there are some patients that have transverse processes that are kind of tucked in and under the mastoid. So he chose to use the adjusting instrument for cases where contacts of the transverse C1 were a little bit more challenging, but he said he could still do it by hand. So once I got into practice, I did very well with hand adjusting. I still think hand adjusting is great. But as my practice grew volume-wise, toggle recoil is a very exertional type of adjustment, and as I started increasing my volume, it started to become a bit fatiguing for me, truthfully. And I had always had the interest in getting into instrument adjusting, and at that point I was looking at actually a chiropractic economic magazine, and there was a picture of an adjusting instrument with the name of Dr. Sweat, and I called up Dr. Sweat after looking at that advertisement for his adjusting instrument, spoke with him on the phone. The following weekend I flew down to Atlanta, and that started my journey with instrument adjusting. And I couldn't say enough about how happy I am, how long it took. In fact, any upper cervical adjusting is a mastering skill, no matter how you choose to do it, by hand or with instrument. And with me, I spent many years mastering the hand part of adjusting, and then it did take quite a while for me to master the instrument adjusting. But once the instrument adjusting came along, the instrument adjustment allowed me to have reproducibility, because the instrument doesn't have a conscience. It doesn't matter if I'm tired or fatigued. It just gives the same line of drive on each visit to correct the atlas misalignment that might come about in our patient. And that's one of the reasons why I transitioned. But I think the take-home message would be adjusting any part of the spine is a mastering skill. The more you do it, the more you get better at it. And I'm thankful that after 38 years, I'm still never going to be good enough, but I always look forward to how much more improvement I can get in my mastering of the adjusting skill upper cervically. And I can't wait to see what I'm able to do in another couple of years. And I just love it. It's been a blessing.
Now for the big one, and my final question, Dr. Rosa. You're using an instrument. Chiropractic means using the hand. Are you being true to chiropractic by using an instrument? And with an instrument, are you still able to have the innate translate?
So, Dr. Sweat, who invented the Atlas orthogonal percussion instrument, before he invented it, he was a hand adjuster. He was one of Dr. John Grostig's hand-picked doctors to carry on teaching his work after Dr. Grostig passed away. And Dr. Sweat, being over 6 feet, came one day and said, bending over a table that's about a foot off the ground to be hand adjusting patients, he felt that there likely should be a more progressive way of doing the adjustment with less stress on the doctor's body, but be able to still deliver an accurate upper cervical adjustment. So Dr. Sweat created the upper cervical group called orthospinology. And when he created orthospinology, he was doing hand adjusting still, Grostic hand adjusting. But then when he came up with the idea of going ahead and creating an instrument, many of the colleagues on the very group that he started went ahead and said, basically, they felt it would be blasphemy to try to adjust the atlas with an instrument rather than the hand. But yet, Dr. Sweat went off, still believing that an instrument would be a way to gain more consistency into the future, to take the hand adjusting variables. Some people are great hand adjusters, some people are moderate, some people struggle with it. Dr. Sweat felt that the instrument would level the playing field, so to speak, to be able to allow, no matter what your skill is with hand adjusting, the instrument would be able to take away that variable and allow people to be able to be more consistent with their adjusting, because the instrument would do the same thing on each visit. In terms of the philosophy, they used to think that doing a frontal lobotomy was the only way to go ahead and help people that were schizophrenic. If you are not aware, B.J. Palmer worked in 2 sanitariums in the 40s and 50s, and at the time they were using electroshock therapy and drugs to help people that were schizophrenic, and only had about a 15% success rate. B.J. Palmer went into those sanitariums and were adjusting those patients upper cervically and had about a 60 to 70% success with those types of patients.
Wow.
So the moral of the story is that chiropractic has to evolve. We started out being the first physicians or practitioners to use X-ray back in 1918, I think, is when Röntgen created X-ray, and chiropractic adopted X-ray before medicine even thought about it. So we adopted X-ray, and we've been using X-ray since 1918, but then after X-ray became other imaging modalities. Now the upper cervical community has embraced cone beam CTs. Obviously I do MRIs. So it is a natural progression to move forward, and I don't see any sinning in using an instrument. All the model of BJ's thought about innate and hand adjustment is that the hand adjustment sets the bone into motion, and then innate will go ahead and take that bone and put it where innate believes it needs to be. Well, the instrument, the Atlas orthogonal percussion instrument that I use, really doesn't do anything any different. When I hit the foot pedal and send that mechanical tap that transfers through the skin and tissue to render the adjustment, I am putting that same Atlas bone into motion, and essentially it is able to do the same thing with my instrument setting a force into moving the bone into motion as the hand would, and that's what my perspective and take on it is. So I don't feel guilty. I'm honored. That instrument changed my life. And that instrument gave me an opportunity to help complex patient cases that sometimes are not very comfortable with a hand adjustment. It's not better than a hand adjustment, I'm not saying that, but it's the model that I chose. I've been doing instrument adjusting for 36 and a half years, and after I had no problems doing hand adjusting. I told you I was excellent at it, but I'm glad that I transferred to the instrument, and I hold no angst about the fact that I'm somehow not being true to chiropractic principles and philosophy because I choose to adjust using an instrument rather than my hands. And that's my take on it.
Thank you, Dr. Rosa, for sharing the legacy of B.J. Palmer, Dr. Crowder, Dr. Sweat, and also putting a twist on the growth of where we can go and see chiropractic leading into the future. Because if we don't evolve, it's not a good thing. Constantly moving forward. Looking forward to the next DC Driving Chiropractic. Thank you, everybody. Good night.